A medical emergency can happen at any time, in any place, to anybody. Your willingness to get involved can make a big difference in the outcome of a situation involving a seriously ill or injured person, possibly a coworker, a friend, or even a member of your own family.
I basically was talking to an individual. He turned around. When he turned back around, I was on the ground. And I have no memory of any of that. So I had no warning, no nothing.
This training will focus on showing you how to recognize and provide initial care to someone who has been seriously injured or has symptoms of a medical illness, such as a stroke or heart attack.
In my case, if someone hadn't stopped to help, Suzanne hadn't stopped to help, who knows what would have happened with my allergic reaction.
You will become an important part of a team of emergency medical care providers that includes police officers, firefighters, EMTs and paramedics, emergency room personnel, and other hospital medical staff. It is important to remember you are not alone. This program will focus on your essential responsibilities as a first aid provider: recognizing a medical emergency, making the decision to help, identifying hazards and ensuring scene safety, activating the Emergency Medical Services System, or EMS, and providing supportive, basic first aid care. This Medic First Aid training program is designed to help you become an effective first aid provider. Your Medic First Aid instructor will use a relaxed, low-stress approach to make your learning experience comfortable and enjoyable. The goal of this program is to help you gain the knowledge, skills, and confidence necessary to manage a medical emergency until more advanced care is available.
Lousy storm. Wonder if the power's out at home. Not a good night to be in a hurry. I'm glad they're in front of us. Just wrecked.
Maybe we had to pull over. What do we do now?
I don't know. Hey, are you okay? Oh no, he's not moving. This is bad.
Are you hurt? What do I do? I don't want to make this any worse.
I wonder if he's dead.
Park the truck so it's blocking the road.
Okay.
Here's some gloves.
Okay. I'll check the guy on the ground. You check the guy in the car?
Yeah.
What's going on here?
He's not moving. I think he was thrown from the car.
Can you hear me? Are you okay?
Hey, watch out for the glass there. Try to stay as still as possible. My name is Anthony, and I'm trained in first aid. What's your name?
Chris.
Okay, Chris, I'm here to help, okay?
Yeah.
Have you called an ambulance?
No, not yet.
Do you have a cell phone?
Yes.
Has anyone called EMS?
I'm doing that now. Yes, there's been a car accident. We're on Jack Kelly Drive, just past the Territorial Road intersection.
Hey, Anthony, can I do anything to help?
Can you get in the back seat and hold his head still?
Sure.
Be careful of the glass.
Matt, is there anything I can do to help?
Can you go watch for traffic?
Sure.
Chris, do you think you're bleeding anywhere?
The fire department's on its way. They want to know about his injuries.
Tell him he's unresponsive, but he is breathing.
He's unresponsive, but he is breathing.
And I'm maintaining his airway.
We're maintaining his airways,
And I don't see a lot of bad bleeding.
but we don't see a lot of bad bleeding.
Can you go tell him about the guy in the car?
Sure. EMS is on the way. They want to know how he's doing.
He's conscious.
He's conscious.
His head is stabilized.
His head is stabilized.
And I don't see any obvious bleeding.
And he's not bleeding. Okay.
A dramatic event such as a car crash is over quickly, usually before you even arrive. Serious bleeding can be hidden. Life-threatening shock takes time to develop. Medical illnesses may display only limited outward signs that they are present. Unlike the movies in which medical emergencies are staged to grab your attention, real-life emergencies may not be as obvious. Commonly, people try to hide or deny their symptoms because they are afraid or embarrassed to admit there might be something seriously wrong. As a first aid provider, your first step to begin treating a medical emergency is to suspect one is occurring. Learn to recognize visual cues that may indicate a medical emergency has occurred. A person in an unusual location or body position. A person making strange sounds, movements, or gestures. A vehicle or piece of equipment in an unusual orientation or location. Damage to or a change in the environment. An odd gathering or small crowd of people. Or a person trying to flag you down or get your attention. In many cases, medical emergencies seem to be less serious than they really are. Your willingness to act on your suspicions is essential and an important first step in becoming an effective first aid provider. The most critical decision you'll make is whether to get involved when you think a medical emergency has occurred. It's normal to feel hesitant because you are unsure of your ability to help. Some of the common reasons why you might hesitate to help are easily overcome. You may think your role as a first aid provider is more involved than it really is. You are the first link in a progressive chain of emergency care. Your involvement lasts only until you are relieved by responding EMS providers, in most cases a very short period of time. You may also hesitate because you think you must have a lot of medical knowledge. As you will learn, emergency first aid is based on simple, effective procedures that can be easily learned and safely applied. You might be concerned about making a problem worse. Basic first aid skills are designed to do no more harm. In some cases, such as when performing cardiopulmonary resuscitation or CPR, you cannot make things worse. You can only help. You may hesitate because others appear to already be providing assistance. If EMS has not arrived, assume your help is needed.
I believe it's important for bystanders to stop and help any individual with a medical problem. Their problem may not be life-threatening, but if you don't help, that problem could become life-threatening, and if you do not stop and help, who is going to? What's going to happen to this individual?
So I think it's very important that people assert themselves with their first aid training and not be afraid to step in and say, I can help, and do it clearly and firmly.
Making the decision to help is the most essential thing you can do for a seriously ill or injured patient. All states in the United States and many other countries have established Good Samaritan laws to protect you if you stop to help in an emergency. These laws provide strong legal protection if you act prudently and within the scope of your training. Always ask a responsive patient for his consent or permission before helping in a medical emergency. Everyone has the right to refuse care. When a patient is unresponsive, the legal concept of implied consent allows you to help, as it assumes an unresponsive patient would give you permission to help if he were responsive and able to agree.